I wanted to start by talking about something that's been getting a lot of attention in our social media comment section lately, and that is the impact that the new regulations are expected to have on natural health practitioners, especially where the $5 million per day fines are concerned. So, just as a brief refresher for the people watching, non-compliance fines within the natural health industry used to be set at $5,000 per offense. But as of June 2023, when Budget Bill C-47 was passed, these fines increased to $5 million per day that you're in offense. And as more and more practitioners are learning about this, they're wondering if it even applies to them and what it could mean for their practice. So, Shawn, I wanted to ask you kind of a two-part question specifically about the fines. So first, do the fines apply to practitioners working in retail stores and making recommendations in retail stores like health food stores? And second, do they apply to practitioners working one-on-one in a private practice?
Those are super questions, and let's give some clarity here. And I'm troubled by your term practitioner because you're using it also in the context of a health food store. And there are practitioners that work in health food stores and interact with the public and give some advice, but they're not really in a practitioner-patient relationship at that point. And this is important, and this is really scary. So it's really, we have to talk about the two last budget bills. So Dana, you were talking about this change where we had a $5,000 per offense fine for the natural health industry, and they moved us into the pharmaceutical fine model in the budget bill in 2023, of all things. So they're making substantive health changes in the 2023 budget. But then, tied to your question, they made changes in the 2024 federal budget where the Minister of Health can basically make it illegal. It doesn't have to go through Parliament, no regulation, nothing. The Minister of Health can just basically make an order that a class of drugs or a specific drug cannot be promoted for or used for off-label use. Okay, the combination here is super important, and this doesn't just apply to practitioners. This would apply to anyone, even like a podcast like this. So now, what is off-label use? So we've got in our Constitution a division of powers between the federal government and the provinces. And the federal government steps into drug regulation using the criminal law power. So the Food and Drug Act and these regulations we're fighting about, it's actually the exercise of the criminal law power. And most of us would agree, hey, sure, step in with the criminal law power and say people can't be fraudulent. So don't say something does something it doesn't. Don't say on the label it's got certain ingredients and it doesn't. And don't adulterate. Don't put something dangerous in there that could harm us. And don't sell something that's unsafe. Like, we'd all agree, hey, okay, that's criminal law power. It just gets interesting then in the area of natural health products when these products as a group are safer than peanut butter. And you're saying we can't sell them without getting pre-approval, whether there's even jurisdiction there. But in any event, the federal government, under their criminal law power, has imposed a licensing scheme. So they will approve a drug for a certain purpose. And let's just use breast cancer as an example. So let's say I'm a pharmaceutical company. Let's say I'm Pfizer, and I want to get approval for a breast cancer drug. Well, I'm going to have to do likely a bunch of clinical trials to get the two necessary to get approval. But to maximize my chances of getting through and to minimize any safety danger signals, I'm going to want the youngest, healthiest women possible. So I might only do my clinical trial on, women 25 to 42, right? Because I know that if I go older than that, I'm going to have more deaths. And I'm going to limit my trial to stage 1 breast cancer because I'm going to have fewer deaths, because I know my drugs is going to be inherently, novel chemicals are inherently dangerous, and chemotherapy drugs particularly so. So let's say they get approval. So they've run, and they'll also do it just for a short time period. We're not talking curing here. We're just talking markers that show improvement. So let's say they get approval for stage 1 breast cancer for women aged 25 to 42. Now, I'm an oncologist. I'm never going to see that patient. But, I've got a 58-year-old with stage 3. Well, I've got no drug to use. I'm going to use that one. That's off-label use. And we just don't run clinical trials generally on pregnant women, for example, and children, for example. So almost all drug use for those groups are off-label use. And in fact, most of our drug use is off-label use. Now, the provinces regulate the practitioners. So that be they medical doctors or be they natural health practitioners like naturopaths or nutritionists. So these doctors, they try to make the best decisions they can on a client or patient basis. So your medical practitioner, it's like, well, how do I think I'm going to get the best health outcomes? And they don't care what the Health Canada approval's for, and they don't have to care. They're free to use off-label use, providing the province and their college allows, them, and they all do, because the goal is to get the best health outcomes. I mean, sometimes a drug's approved for one condition, doesn't work very well for that at all, but doctors learn because they've prescribed it for that condition, and patient after patient's coming back and saying, well, it didn't do anything there, but my gosh, my gout's gone type thing, right? So, we have drugs that are approved for one purpose that are largely used for another. Well, the company's not going to go and run a clinical trial and get approval for the other thing. They've already got approval, so it doesn't matter. Off-label use. So back to your question, Dana. So what changed in the 2024 budget is now the Minister of Health could basically make an order saying for all natural health products, you cannot promote those for off-label use. It's an offense. And our offense has gone from $5,000 to $5 million a day. Well, now I'm working in a health food store, and somebody walks in and says, I'm suffering from migraines. Now, I want to tell them this type of B vitamin, and this type of magnesium, is really likely to help. And that's like kind of standard advice. But now it's an offense for me to do that if the Minister of Health makes that order, because that's off-label use. The magnesium won't be approved to help with migraines, and the B vitamin complex won't be approved for that. And so you see the danger. And like naturopathic doctors, I'll just use them as an example, just because I have some personal knowledge of Health Canada going after them when they're advertising truthfully for things like intravenous vitamin C, helping to mitigate and get you through chemotherapy, for example. Well, it's not approved for that. That's off-label use. And, and Health Canada threatens them with these $5 million a day fines. So if a practitioner is working in a health food store, if you're not in a practitioner-patient relationship, you're in trouble. So I would say almost all advice given in a health food store, that is not protected by practitioner-patient. Now, to my understanding, you've got a patient in your office and you're giving one-on-one advice to that patient, it's not an offense for you to tell the patient the truth. It may, if the minister passes an order saying you can't use natural health products for off-label use, it will be an offense for you to sell them products for off-label use, because a lot of just using naturopathic doctors as an example, a lot of them sell products. And definitely traditional Chinese practitioners compound and sell products. That will become a full-on offense if the Minister of Health passes that order that I'm anticipating in the future. And it'll just happen. It'll just be published in the Gazette and it'll be a done deal. Doesn't even have to be. But the minister just issues an order and they publish it on their website, basically banning the promotion of all natural health products for off-label use. And we're all in a world of hurt. So can you imagine the health food stores, if their staff can't be giving advice like, well, why don't you try magnesium and this vitamin B complex, for example, just sticking with this migraine example. Can you imagine if that advice is not able to be given? And it's truthful health advice. We're not even talking about fraud. So if people can't go into a health food store and say, I've got this and I've got that, and what do you recommend? Because Health Canada has shut down some stores by charging them. Wow, we're in a different world, aren't we? And so if I'm a practitioner, I'm worried about this increase in fines. If I'm a store, I am selling my store. I'm just telling you, if I owned a health food store, I am getting out of the business now. Now. Not tomorrow, today. Because my business could be worthless. Just one order could be worthless. It's too much business risk.
I did just want to add something. You've talked about this a lot. One of the other major impacts that is going to affect practitioners, especially those operating in a one-on-one setting, isn't related to fines. It's about product loss, right? So practitioners often rely on hundreds, even thousands of products to run a complete practice, especially homeopaths. They often need thousands of products. And if those become unaffordable for their clients, or if they disappear from the market entirely because of new regulations, it really becomes harder for practitioners to run a complete practice and deliver the type of personalized care that natural health practitioners are really known for and that their clients need. So it's not just bad for their businesses, it's really bad for public health. And I kind of have one other thought I'd like to add in. It just brings me to a broader issue that, Shawn, you recently brought up on the news forum. You were on there live a little while ago, and that's the tie-in to Canada's doctor shortage. According to news reports, over 6 million Canadians don't have regular access to a family doctor. And then at the same time, politicians across all political parties are talking about this, trying to offer solutions. Meanwhile, new regulations are being imposed on the natural health industry that are going to make these products and practitioners less accessible. And what's that going to do? Many of the people who are effectively managing and preventing acute and chronic health conditions with natural health products and with the help of practitioners are going to be forced to rely on a conventional medical system that's already overwhelmed and understaffed. So it's really just not a good picture looking forward. And it's very ironic that a doctor shortage is happening at the same time as new regulations are being implemented that's going to harm the natural health industry.
We invite you to get involved. Visit nhppa.org/subscribe to receive our weekly newsletter. NHPPA, dedicated to protecting Canadians' access to natural health products since 2008.